Hello, everyone. Welcome to our panel discussion today. I will start by sharing a land acknowledgement. So as we embark on today's journey of learning and reflection, it's important that we recognize the systemic manner in which some communities on the land we call Canada have been impacted by eating disorders. First Nations, Inuit, and Métis peoples often had their traditional methods of procuring food and their relationship with the land forcefully altered through the processes of settler colonization. The residential school system aimed to sever these connections among children with exploitative processes and treaties that weren't upheld, creating legacies that still impact the well-being of people to this day. In Canada, dietitians participated in experiments on Indigenous children at residential schools without their or their families' knowledge or consent. Social workers have removed Indigenous children from their families and cultural knowledges. Therapists, psychologists, and psychiatrists often work within the confines of treatment modalities or assessment protocols that have primarily been researched among white folks. Reconciling these truths and committing to change involved understanding how we can build a society where we can embrace conversations about identities, social conditions, and health, and how these things intersect. As we talk about pathways to working in the eating disorders field this evening, we believe it's important to recognize how complex histories of whiteness and colonization present barriers for people who are Indigenous, as well as for people who are Black and those with other intersecting identities that experience marginalization in our field. As a non-Indigenous settler myself, I see acknowledging these truths and actively working towards reconciliation as critical. If you're curious about learning more ways that you can take action, Ari is going to share some links in the chat. A couple that I will specifically point out. One is NEDIC's recent initiative, which is the creation of guides to eating disorders in Black, Indigenous, and people of color communities by and for community members and carers. And so there is, or there will be, an Indigenous community members resource. It's currently in the works, but the link is in the chat. So please do check that out when it becomes available. Another post by an Instagram account called Nutrition Diversified. What does reconciliation look like in dietetics? Which relates directly to some of the themes that I have mentioned. Okay, and if anyone else has, if any attendees have other relevant resources, please share these in the chat as well. We have the chat open for today, and we plan to keep it open. So again, thank you everyone for being here. My name is Caitlin. I use she, her pronouns, and I am the manager of community outreach and education at Sheena's Place. I will be your moderator this evening and your co-host along with Ari from NEDIC. And so I'll tell you a little bit about Sheena's Place and then I'll pass it over to Ari. So for those who are not familiar, Sheena's Place is a community mental health charity, and we provide group-based support to people affected by eating disorders and disordered eating. We offer a wide range of groups and workshops to anyone ages 17 and older in Ontario. Most of our groups are virtual, but some are in person in Toronto as well. All of our groups are free of charge, and an eating disorder diagnosis is not required to attend. And so if you are looking for more information about accessing groups at Sheena's Place, you can send an email to info@sheenasplace.org or reply to the email that you got with the Zoom link in it. And I'll pass it over to Ari to share a little bit about NEDIC.
Hi everyone, my name is Ari. I use he, him pronouns. I'm the Outreach and Education Coordinator at the National Eating Disorder Information Center. We're a registered Canadian charity that have been helping people affected by eating disorders since 1985, and we operate a nationwide toll-free telephone helpline, as well as an online live chat program that provides support, information, and referrals to people who are affected and those who care for them. You don't need a diagnosis to contact our service. It's an anonymous and confidential service, and anybody can reach out. Around 30%-ish of those reaching out are people who are trying to support someone else. If it's a concern for you, it's a concern for us. Like Sheena's Place, we also deliver prevention-focused workshops to youth and facilitate professional development in person in the Greater Toronto area and online across the country through our outreach and education program. And if you have questions, you're free to send a private message to me in chat. You'll see chat and text support next to my name. or email nedic@uhn.ca. And I will toss this back to Caitlin.
Thanks, Ari. So you'll notice again that the chat is open to everyone. If you have a tech question, like Ari said, please send him a message privately. But if you have a question or a comment in general for the panelists, you can send that to everyone. If the chat does become too distracting, we might pause and turn it off for a bit, but I don't anticipate that will happen. I will just remind everyone to stay on mute while we're here, unless you are asking a question during our Q&A. Another couple of things to mention, live captioning has been enabled. So if you would like to read captions to help with accessibility, you can click on show caption on the bottom bar on Zoom, and you can hide it as well if you're finding that distracting. As mentioned, this panel discussion is being recorded and it will be posted on both Sheena's Place and NEDIC's YouTube channels within the coming weeks. We will not be recording the breakout room portion of today, only the part where we're all together in this one room. So we'll start by introducing our panelists. We'll ask them a few of our preset questions, and then we'll open it up for attendees to ask questions to our panelists. Then, as I mentioned, we will have an opportunity to move into breakout rooms. So one panelist per breakout room, where you can ask them more targeted questions and have a chance to connect with them in a slightly smaller, more intimate space. And then we'll return to the big group for a final wrap up and reflection. Before we get started, just a reminder to everyone to please do what you need to do to take care of yourself during this event. You might find that surprising or difficult emotions come up. And if so, Ari will be available to provide support via chat if needed. We also do have a few language guidelines for our panel this evening. So the panelists and myself have been asked to speak from the I perspective and to not make assumptions about other people's experiences. Panelists only represent their own perspectives, and we acknowledge that there are many perspectives that we don't have with us this evening. We're also asking panelists to avoid going into detail about traumatic experiences or eating disorder details. So not naming any specific numbers or details about eating disorder symptoms. And so we ask that you as attendees keep these language guidelines in mind as well while asking questions and engaging in discussion, both in the main room and in the breakout rooms. So with all of that said, we will now bring our panelists into spotlight mode so you can see them. Amazing. Okay, hello, welcome to you all. We're going to start with a really well, sort of basic, but also could be a big question, which is to just introduce yourself and to share what your current position and work is and how you first got involved in the eating disorders field. So whoever would like to start, go for it, and then maybe I'll go in a circle from there based on my screen. Anyone? Amanda, you're at the top if you do want to go first.
Sure, I can do that. Hello, everyone. My name is Amanda Rafool, and I'm a Canadian Institutes of Health Research fellow working actually in Boston, Massachusetts, in the US right now. I work with a group called STRIPED, which is the Strategic Training Initiative for the Prevention of Eating Disorders. And I am primarily a scientist with STRIPE that has a lot of focus on trying to translate research into policy action and advocacy. I came to the space of eating disorders when I was in my late teens doing my undergraduate degree at the University of Windsor in Windsor, Ontario. I always say I slipped into eating disorders as a happy accident, but I was going through my own struggles with disordered eating and happened upon a volunteer opportunity at the local outpatient eating disorder treatment center in Windsor called BANA, or a regional one, I guess. And I started volunteering with the organization, doing some really basic data entry type of work, and then was recruited into their health promotion team. So I didn't go into research first. I was doing information booths at malls and doing school presentations about body image and nutrition. And as I spent more time in that space, got, a little bit more familiar with my own body and relationship with it, and got embedded in community, it inspired me to do graduate degrees in public health so I could work on preventing eating disorders through broader systems and policies. So I'm excited to talk with folks about that today.
Amazing. Thanks so much, Amanda. John, do you want to go next?
Sure. Thank you, Caitlin. Hello, everybody. I'm John Choi. I'm the executive director at Sheena's Place. So the organization Caitlin spoke about in some detail earlier, so I won't go any further into that. But yeah, it's a real privilege for me to serve in this role in this organization. I had spent, I guess, close to going on 30 years in the mental health field at this point, starting in frontline roles, learning a lot about assessment and treatment of a wide range of mental health disorders, and spent a good amount of time working in community settings, supporting young people and their families. And then I guess the last couple of stops prior to Sheena's Place, there was a real emphasis on um, ensuring that folks who were using the services, part of their experience was that they were seen and that they were heard, and that they were deriving benefits from a feeling of connection and belonging, and the community was a strong focus of the spaces that I was working in. And then the Sheena's Place opportunity sort of presented itself, and I hadn't had significant experience working in eating disorders. In fact, I'd spent a lot of time supporting clinicians in situations where if an eating disorder was identified, we would engage in some external supports that were specialized in eating disorders. So it was always a topic that was one step removed from the supports that I was involved in delivering. But as I learned more and more about the challenges that individuals with eating disorders faced, I became more and more curious and intrigued by just how complex the situations were, and the extent of the needs often that we're presenting for folks in those situations. And with the alignment of those experiences in working in community-based settings, with the philosophies of peer support and community and connection, when the Sheena's Place opportunity presented itself, I was strongly drawn to the organization, very strongly interested in learning more about eating disorders, and through, I guess, some good fortune, secured this role, and spent a good amount of the early period of my stay at Sheena's Place learning about eating disorders, and I continue to learn almost on a daily, or at the very least a weekly basis, from colleagues and from participants in our space about eating disorders, and sort of still feeling a little bit on the steep sort of portion of that learning curve, but feeling privileged to provide some support and assistance for the team at Sheena's Place and for our participants.
Thanks so much, John. Nolan, you're next on my screen.
Great, thank you. Hi, everyone. My name is Nolan Blodgett. My pronouns are they, them. I'm a psychotherapist or social worker by training. I currently work full-time in my own private practice, providing psychotherapy, as well as consulting and other work as well. So I kind of got started in eating disorders when I got a volunteer opportunity at NEDIC, which Ari described earlier, while I was in grad school, and I was not planning to work in eating disorders. I had some lived experience of that myself, and it wasn't something that I was necessarily set out to work in. And then I found working with the queer community, it's super prevalent, and it just repeatedly was coming up with clients. And so that's when I became more interested, particularly because in the eating disorder field, there's been these stereotypes for so many decades that of who's affected by eating disorders, and rarely were people like myself or my clients represented in that. And so I started to become more curious about that. And so I started developing workshops on body image tailored to queer men in particular, and offering that kind of thing. And they were so popular that I really started to see how much of a need was there. So now I do a lot of individual therapy around that. And just this past year, I also taught a course, developed and taught a course at Trent University called Intro to Critical Fat Studies. And so we're focusing on sort of unpacking fat phobia, and sort of a lot of the roots really of eating disorders. And so I've really enjoyed kind of doing the clinical work and at the same time doing a little bit more of the education piece and sort of understanding what's happening at a larger level. So that's how I've landed here. Thanks for having me.
Thanks, Nolan. I would love to take that course. Jennifer, you're up.
Hi, everyone. It's nice to be here today. I'm coming to you from Vancouver, working on the traditional and unceded territories of the Coast Salish people. So that includes the Musqueam, Squamish, and Tsleil-Waututh. And right now I wear 3 different hats in my work. So I'm a psychologist who provides clinical care. Right now I work in a pediatric eating disorders center where I might give family-based therapy or cognitive behavioral therapy for youth. Also working with families of youth with eating disorders. I'm also a researcher, so collaborate on several national projects. About half of my time is spent doing research, looking at predictors of treatment outcomes and looking at how we can improve services for eating disorders. And then I have a hat as my clinical faculty role at University of British Columbia, where I do some seminars and courses for primarily psychology, pediatric, and psychiatric residents who are training in mental health. And I think similar to some of the panelists who are hearing about today, I slipped into the field by accident. So I was actually in my undergraduate time working in a lab looking at animal sexual behavior, so the sexual behavior of rats, and trying to find a directed studies project and looking at options. And there were no options at that time, but in that lab there was a graduate student who was doing some work on models of eating disorders, and they said, was that something you'd be interested in? Okay, why not? Give it a try. And that started my pathway that has led me to be highly specialized and working only in clinical settings and research settings for eating disorders. So I was fortunate to go on to graduate school in Toronto, where I studied more about eating disorder symptoms, disordered eating, chronic dieting, and then in my postdocs, which I went on to Europe to do, started specializing more in eating disorders, and then came back to Canada, where I've had these mixed clinical research positions. And I look forward to chatting more about these pathways with everyone today.
Thank you so much. Yeah, it's already so interesting to hear the similarities between people's paths, the sort of accidental or serendipitous entry into the field, while also acknowledging how different these paths are, whether it's through clinical work, research, education, community outreach. So thank you all for getting us started with that. The next question that I will ask is about challenges that you have faced while working in this field. So if anyone would like to speak to challenges that they've faced and what has helped them overcome, or not overcome, but face those challenges. And I'll let you decide who goes first this time.
I can jump in first. I think when I was reflecting on this question, one of the first thing that comes to mind that I routinely speak about with my colleagues is the challenge of people being really worried about coming to work in this field. And so when we do some of those seminars or education sessions, for example, and we ask if there's anybody who's planning to go on or do a rotation in our program or some eating disorder service, we often hear, no, that's not something that we're interested in. And I think that comes hand in hand with worries and stereotypes about the field that we're working hard to try to dispel. And what has been really great for me in my role as supporting some of the psychology residents who are coming to the service and telling me I've never worked in eating disorders before, and I suppose I'll choose this as one of my rotations. And then coming to the end and saying, you know what, I think I'm going to go on and apply for jobs in the field, because once people are in, I think it demystifies a little bit, understanding the skills that people bring in other areas also can apply to working in this kind of specialized setting. And I think the second part that I often hear from people who are new to the field is the strength of what it means to work together on a team, and that being something really magical that people don't always get in some of their other settings. So I think some of the challenges, it really takes supporting people and encouraging them to give it a try. And then just like I fell in accidentally and stayed, I think people start to realize that some of the preconceptions that they might have held before coming to do research or do clinical work in this setting starts to shift, and I see people become passionate about it. And my research coordinator was reflecting the other day that in her psychology background training, she said she had maybe 2 or 3 slides out of her entire background of education for her degree on eating disorders. So she came in really knowing nothing about it. The job opportunity came up with my team, and she's saying now she wants to go on to grad school, and the big part was just not having the exposure and not understanding what a career could look like or what different opportunities look like in this field.
Thanks, Jennifer. Yeah, a lot of fear of the unknown, and I think there is not a lot known about the field. Like you're saying, even in courses about mental health in school, people are not necessarily even learning about eating disorders, and so how would they even know what to expect when working in the field, or how to get there? Anyone else?
I think from a non-clinical public health perspective, the challenges that I face are a lot different, and it's more so convincing people within public health that eating disorders are a topic that they should care about. And that's a harsh reality that I didn't think I would have to face when I first entered the field. And so I think my experience as a public health researcher doing eating disorders work has always been trying to fit the topic of eating disorders into other spaces. So during my graduate studies, I did a lot of nutrition policy work, and I would try and squeeze eating disorders into those spaces and topics and areas, and often was met with a lot of the same resistance that Jennifer kind of touched on around people misunderstanding them or not seeing the need for eating disorders in public health policy and prevention. I've done work in collaboration with folks that do weight-related work in public health spaces and faced a lot of challenges and barriers in those encounters, and even just trying to do general mental health, public health preventative work has been difficult. So I think that trying to find a space for eating disorders in the public health field has been a challenge that I still struggle with to some extent, even though I think I'm getting a little bit more comfortable standing my ground in a lot of those physical and virtual spaces. But it is a bit different when it's not clinical and you're trying to talk to folks about something that they see as only clinical. So.
Yeah, absolutely. Thanks, Amanda.
Maybe just to piggyback on what Amanda was sharing, that really trying to help people wrap their heads around the pervasiveness of the issue and the intensity and the prevalence. There's just so many misconceptions and misunderstandings surrounding eating disorders that we have to continue to try to bring people around to understanding. And I think that sort of continues to be persistent as a challenge of working in this space. We support a lot of folks at Sheena's Place who are navigating different types of options for treatment or for getting help in different settings. And we repeatedly hear stories of the barriers and the challenges they face. We continue to hear stories about mixed messages or conflicting messages that they are receiving from healthcare providers or other supports in their natural environment. And even for me, just having conversations with my partner at home or other people in my network that have just, I guess, grown up and live with some ideas and beliefs that are more consistent with diet culture than a healthier approach to understanding, approaching eating related issues without judgment. And yeah, there's just challenges on so many different levels based on people's understandings or lack of understanding of the issues that we're trying to address and support folks through.
Thanks, John. Nolan, any challenges you'd like to speak to?
Yeah, I think very, similarly to what folks have shared, my challenges have mainly surrounded working with folks who are not really like seen as important in the eating disorder field. I don't know if that's the right language, but most of my folks that I work with are like often larger sized, for example, and often excluded from like medical programming where there's like a BMI limit to get treatment or things like that. And there's a lot of misconceptions where often people are not being believed by their family doctors or other important people in their care networks that this is a problem for them. And I think those misconceptions about what eating disorders look like in people who are larger, people who are queer or trans, can be really tough to navigate. And particularly being in private practice, it's really isolating because I don't have access to another care team at all. And so, a lot of the folks I work with, their eating disorders are like relatively stable, and we're kind of working on getting more at like the root cause of it and that kind of thing. But sometimes folks get to a place where they really need medical intervention, and it's really hard as like a private practitioner in the community to help folks navigate that. And so it can be really intimidating. And sometimes those more serious or more like urgent cases feel scary for me because I'm like, I don't have a direct line of communication with a physician or someone. And so there can be like a lot of imposter syndrome. Like, can I even do this work? Or should somebody, more qualified do this? But then not a lot of people are doing it, especially with the population I work with. So I think it's just a lot of coming up against feeling like I don't really know what I'm doing, but also nobody really knows because nobody is researching it in these specific communities a lot of the time. There's not a lot of resources specific to these folks. So I feel often like a little bit of a trailblazer without even necessarily wanting to be. So that's been my main challenge.
Yeah, thanks so much for sharing. I'm hearing like a lot of different challenges coming up, and I think in everyone's answers, though, I'm also hearing like a lot of persistence and creativity in increasing understanding or finding solutions, patience as well, and compassion for oneself and for other people. So thank you all for sharing about that. I'm wondering if we can flip flip it a little bit and now speak about the rewards of working in this field. Like, what do you find to be some of the more rewarding parts? And anyone can get us started.
Maybe I'll start and I'll be brief, but I guess before I speak specifically to the rewards, sort of acknowledging and expressing empathy for each of you in the struggles that you're facing and the hard work you're doing. I think it's worth mentioning that there is like a lot of good reasons for hope, that things do seem to be shifting, and it's absolutely challenging and frustrating, and all the barriers we've talked about are very, very real. But it is nice to see that governments are willing to direct more resources than they had historically been towards eating disorder supports. And there's a growing acknowledgement of the issue. So at the very least, there's some incremental change that seems to be happening. That is some reason for hope. And speaking for myself in terms of what's been rewarding, absolutely consistent with my other experiences in working in other areas of mental health. Any opportunity to interact with participants or service users and hearing some positives about their experience, and working with members of my team, both internally and at Sheena's Place, we're blessed to have a fairly sizable roster of professionals who support the delivery of our programming. There is no shortage of inspiring and happy stories that I'm very privileged to get to hear, and those sometimes contained experiences, they seem to kind of string together to absolutely sort of buoy the overall experience and make this job very rewarding.
Thanks, John.
Maybe I can follow up with John's reflections, because I think that hope and seeing some change in the field is really what's standing out for me in the last year, where prior to this, I had many colleagues applying for research grants from large agencies like the Canadian Institutes for Health Research and not getting them. And now it seems like every time somebody's applying, I'm hearing good news about somebody in the field, and new guidelines coming out from Jennifer Couturier and her group at McMaster that then led to this development of a Canadian panel that could look at some virtual care, and some of the work of other colleagues across Canada about developing guidelines, developing new services. And I think it's an exciting time. And I think linked with that is the passion that many of my colleagues, both from the clinical side as well as research side, have. And I had the fortune last week of having a large event here in British Columbia that some people joined from across Canada through the Eating Disorders Association of Canada, and hearing people's passion and ideas as we heard our keynote speaker, and thinking about how can we look for some ways to change our system, and people really wanting to continue improving things. And I think from my own clinical lens, that has been one of the things that has kept me in the field, because we provide services. And I think particularly for me, being based in a pediatric setting, seeing change and seeing kids get back to their life and getting those follow-up updates that somebody's off at university or had a baby, or other exciting life updates that for families at the time that they're first coming to us in crisis just seem unfathomable of how to even survive the day, let alone get to these positive places. And I think that has been a really rewarding aspect that has led me to also try to think more about how can we have more patient-oriented research within our own program, and try to weave in more of the stories of people to guide some of the directions of where we're going moving forward with our research.
Yeah, I can piggyback off of that. I would say that what's most rewarding for me, definitely, as both of you have just said, is the hope. I think this field is like, everyone I've met that works in it is so passionate and so excited about it. There's so much room for creativity and innovation, because there's so much work to do. And so every time I connect with somebody new in the field, I feel like more inspired. And I think one of the reasons that I love doing the education side, whether that's in a university setting or more in community settings, is every time I start to see people, just even take away a little bit about unpacking their own internalized ideas about diet culture and fat phobia, it feels like making this larger impact. It's not just the people struggling with eating disorders, but also we're, creating more of a social shift in understanding our relationship as humans to food and eating, because it's so much bigger than an individual clinical problem. And so I think coming together in like events like this and conferences and things like that are always what kind of keeps me going in this field, because I feel, excited about the opportunities that we have to build something really great. And then obviously in the clinical work, seeing those long-term changes and seeing people actually be able to sort of come to a place where they feel like they're, in recovery, whatever that means for them, or, be able to kind of enjoy their lives again, or enjoy food. That's always a really beautiful thing to watch and to witness as well.
Absolutely. Thank you, Nolan. Amanda?
Yeah, I think everyone's touched on a lot of the really hopeful elements. And I think the progress, especially we've seen in the last 2 to 3 years in the funneling of resources into eating disorders, into the expansion of clinical care. I want to acknowledge like that comes on the back of, or the backs of people who've been doing this work for decades, who didn't really see much happening. And I think that, you know, there was this threshold that either happened and was triggered because of the pandemic and the really unfortunate rise we saw in cases of eating disorders or concerns around disordered eating in the population, but also the fact that a lot of people have been doing this work for a while. And I think as a field, we're getting really creative about ways to move ourselves up the priority lists and political agendas. And I can even say that like in the policy advocacy I do, I find it really rewarding when not just that I do a research study and then it goes off into a journal, but when I can take that to a policymaker and say, this is why, for example, diet pills are harmful and we need to get them off the shelves, or this is why weight discrimination causes a whole range of negative health issues and economic costs to society as well. And so I think that the fact that we now have this space where we've creatively adapted ways to get our work out there and to help populations is a really positive thing that's been a long time in the works.
Thanks, Amanda. Yeah, definitely a lot of common themes around hope and noticing things changing in recent years. Yeah, thank you all. I'm going to ask one more question and then we'll turn it over to the audience. So for attendees, if you do have questions coming up, you can send them to Ari directly in the chat. If you want to send them anonymously, you can send them to everyone, or you will have the chance to ask out loud. So as you're thinking, I'll ask this last question for now, which is, what could we as a community be doing more of in order to proactively encourage more people to work in this area? What supports do you think are needed? What could we be doing?
Maybe I'll take it before I hand it over to the clinical folks or the primarily clinical folks. I think from a public health and research advocacy perspective, we need money. Like I think that Jennifer was talking about like grant funding for eating disorders was like basically impossible for many years. And then now we have a little bit more progress, but for folks to go into the field, especially folks who come from disadvantaged socioeconomic backgrounds, they need to have the resources to go into a space where we don't have, you know, industry funding the same way other health issues might, or we don't always have as much philanthropy money coming in. And so I think that government resources will allow for more folks to enter the eating disorders field as researchers, but also as policy advocates, because it's really tough to be an advocate. And I've had this conversation with so many people that work in clinical settings for eating disorders, especially. It's really tough to be an advocate when you have a wait list for folks that want to see you clinically, or if you yourself are struggling in your own ways. And so I think that having those resources will allow people to be a little bit more flexible with prevention research, but also with some policy advocacy too.
Absolutely. Thanks, Amanda.
And maybe I can draw on some of the experiences from a colleague from Australia who was at our event provincially last week, Dr. Tracy Wade, who is in Adelaide, Australia, talking about the innovations in Australia and what helped them make some advances. And I think she was really highlighting the importance of having a unified voice of stakeholders that included people with lived experience, people who are working in the field, policymakers, to come together to show the need for these services. And ultimately, they've been able to develop a national center for research and knowledge translation. They've been able to implement more publicly funded or subsidized services and streamline a certification process so that consumers know that who the people they're going to, whether they have appropriate credentials and specialization in eating disorders. And I think looking to some of our international colleagues and some of the work that that has been done there can help us reflect on how can we make these innovations in service provision, service transformation, so that it, I think, becomes a more visible place to work. And then from a more detailed focus lens, it's starting to set some of the expectations. Like in some services, people, if you don't choose to do a rotation in eating disorders, you have no exposure to clinical service in eating disorders. And yet I have many colleagues who are not specialists in eating disorders reaching out to me saying, gosh, I'm working with somebody in private practice and they're really having a hard time and losing weight. And I think they may have an eating disorder, and what should I do? And so kind of realizing, how can we support people who aren't specialists in the area as well, to have enough education support to help their confidence in being able to support in whatever their setting is as well.
Yeah, I would say echoing everything that's just been said, I think what comes up for me is that a lot of the time people don't recognize like how common disordered eating is, and it can't just be these like specialized treatment programs that can be so hard to access and have these long wait lists. We have to look at more broad kind of societal shifts that we can make. And so I think education is a huge one. Like I barely heard about eating disorders in all of my time in university. So most of my education or qualifications were things I sought out on my own, paid for on my own. And so I think really exposing not just clinical students, but also like people in a range of different disciplines, because some folks come from all different backgrounds that end up in policy and research that could be relevant. And then I think, so often when I'm with clients one-on-one, I feel like, we're just kind of putting a band-aid in a sense on the problem. Like we need to do more. And so what I do that makes me feel better, at least, is to really, whenever I can, try to like educate everybody around me about diet culture. I think on a daily basis, I probably hear somebody make some kind of comment that kind of perpetuates some harmful idea about food. And so just trying to like educate more broadly in our lives, the people around us, our colleagues, to like start like more of a social shift in how we think about it. Because I think if it stays this very specialized field that only folks in it are looking at, we're not going to see the change that we need to make.
I would,
Thanks, Nolan.
sorry, Caitlin. Yeah, I would definitely echo all of the comments and the sentiments that had been already shared. I think it does really boil down to expanding our conversations and finding ways to include the discussion of eating disorders and our discourse and our dialogue and each and every opportunity we have, just because the lack of awareness is so significant. I often wondered, when different types of clinicians or physicians decide on specialties, sort of what goes into that thought process. But um, just creating more opportunities to the extent possible, and hopefully an event like this might help. Maybe there's one or two folks in the audience that may be swayed in a different direction as a result. But at Sheena's Place, we're also working on continuing to develop more and more resources to provide education to folks, to increase their awareness of what opportunities might exist, or in what different ways someone might come to work in the eating disorders field in a variety of disciplines. And in the way that Nolan mentioned, that it's not just a social worker that would be someone who worked with someone, or just a physician who worked with someone. That social workers and physicians are important, but so are psychotherapists and dietitians and yoga instructors, or just there's such a breadth of different folks. If they were trained in how to support folks with eating disorders better, could make a positive impact in our space on a broader level.
Thanks, John. Thanks so much, everyone. And I think this actually leads very nicely into our first attendee question, which I'll read out loud, just word for word. So this person says, my question is about how to work in this field if you don't have post-secondary education in psychology or sociology. It seems like all of the panelists are highly educated, but are there positions for BIPOC who have lived experience with ED? It seems as though to get the qualifications to work in this field, I would have to endure working in very oppressive institutional spaces, i.e. universities, hospitals, healthcare settings, for me as a queer BIPOC, which would be expensive financially and also from a mental emotional health perspective. Any thoughts, any ideas for this person? And I imagine others who are thinking similar things.
Maybe I can jump in again, drawing on our Australian colleagues and some of the models that they've been developing. They're sharing that there are programs where there were requirements of people with lived experience as mentors, and really trying to build in the expertise of people with lived experience alongside health professionals in psychotherapy, psychologists, and other pathways, and showing some good evidence about the power of connecting with people with lived experience and figuring out how does that fit within the system, and also highlighting some of the inequities that sometimes happen around the pay structure. So thinking about how to adequately and appropriately compensate all individuals working in the field, including mentors and consumers. So I think there's more attention and awareness is what I'm seeing and hearing about. And I think there's some shift away from some of the more traditional models that I, for example, represent in terms of my training.
Yeah, I would agree. I would say also, I did a lot of work in this field. Most of it was volunteer, but before I had my education or while I was in university, and a lot of those roles were like peer support or peer mentorship type roles. I also really enjoyed, and I think this is probably happening more and more as research is more funded, a lot of community-based research projects or that are, kind of studying marginalized populations will look to like community advisory boards or things like that with people with lived experience to kind of direct or help shape the research and program. And so I've participated on a number of those, not as a therapist, but as a person with lived experience. And I find that was always very rewarding to be able to work with those researchers who are doing that institutional work and be able to give your input. And then volunteering with or working with like community organizations that are doing some of this work in less formal ways. I'm biased, but I got started with NEDIC, and it's like a very lovely small team of humans just like making resources and like doing education and doing all this great stuff. And it's not, I never had this sense of it being like hierarchical or like elitist or anything that like hospitals and universities can feel like. I think those community organizations like Sheena's Place, like NEDIC, can be such a lovely space to kind of start getting work experience in the field.
Thanks, Nolan. I think, Amanda, had you unmuted before? Is there anything you wanted to add?
I feel like most of it has been said, and then someone in the chat put in an item around peer support roles, which have, don't require any background in education and training, but really have to do with your own interpersonal skills and your own experience and positionality too. So those are a great option.
Agreed. All right, so we have two more questions. I'll try to combine them because they're both about the same topic. So wondering for panelists, and I think this is mostly directed towards Amanda and Jennifer, who spoke to funding and grants. But what have you found to be the most effective way or ways for getting money and funding? Any strategies?
I guess like from a policy public health standpoint, when I write about the work I'm going to do, I really try to sell it within certain contexts and put a spin on it that will make government decision makers and other folks reviewing grants feel like it's appealing. And that's kind of like a sad and harsh reality of trying to sell the issue of eating disorders. And so I think that the governments of, provincial governments across Canada, and then the government of Canada and funding bodies more generally have been a lot more accepting and open to accepting applications around eating disorders research in the past few years that we've talked about. But one thing that folks in the space will do was they'll talk about or they'll integrate eating disorders research into general mental health grants, for example, or they'll talk about exploring disordered eating in reaction to a nutrition policy, and they'll apply to nutrition grants. And so I think we get pretty creative when we need to find a space for our work, even though, of course, it is getting a lot better on that front. And then I think there's also different people in the field have different beliefs about the role that industry funding can play. And I know that folks from different countries have collaborated with industry organizations that will provide money for research or for outreach and access to services. And so although different people have different opinions on taking money from industry, that's always an option that people can consider as well.
Thanks, Amanda.
Sorry, there's
Jennifer.
things rolling down the hallway behind me, so apologies if you have background noise. I think it's over now. I see on the call that there are some colleagues from the National Initiative for Eating Disorders, or NEED, and one thing that's coming to mind is the Canadian Eating Disorder Strategy that was put together by the primary Canadian Eating Disorders organization. So please correct me if I missed something. I think it was NEDIC plus NEED plus the Eating Disorders Association of Canada and the Eating Disorders Foundation of Canada, and bringing together stakeholders. And I think this provides some of the foundation that, although we're not in a place where Australia is, we're working towards having more national stakeholder discussions and starting to do those priority setting exercises and bring together a more united voice that is helping move forward the field as well. So I think that's one of the steps that has already been made, and then some of the individual groups. Thank you for putting that in the chat area. Some of the individual groups of researchers who are bringing together different stakeholders as well, rather than it just being the small group of people at any one institution that is also helping us move forward, because some of the challenges have been trying to have enough participants. It's hard to do at any one site. So really about bringing together multiple sites to have enough detail in the research data to be able to draw conclusions and then build on that.
Yeah, absolutely. Thank you, Jennifer. So I see that we do have someone with their hand raised, and we have a couple other questions in the chat. Just being mindful of time, I think what we'll do is we will go into our breakout rooms now, and you're welcome to ask those questions. Go into the breakout room that corresponds to the person who you have a question for. So how it will work is Ari will open the rooms, and all attendees can choose which room they would like to join. So you'll hover your cursor over one and click join. The rooms will be open for about 12 minutes. We will not record those breakout rooms. And when the 12 minutes are done, we'll close the rooms and we'll invite everyone back to the main room for a final wrap up and reflection with our panelists. If you have questions, feel free to hang back in the main room. Ari or myself will be here and we'll be floating between the rooms. So Ari, go ahead and you can pause the recording and open up the rooms. Awesome. Okay, so with our last 5 minutes together, I'm curious about final reflections from our panelists. What stands out to you most about today's panel? Either sharing that and or any advice you have to folks who are hoping to get involved in the eating disorders field. Who'd like to start? Amanda.
Sure. I think one thing that's been stressed by most of the responses is the need for community and coalition and teamwork across. And so maybe one final point for folks that are interested in joining the field or just starting out is to reach out to networks and connections. I've never reached out to anyone in the eating disorders field in Canada and had them ignore me or tell me no. So I think that really is a testament to how much we all want to work together to overcome or at least take on some of those challenges and barriers that we've been talking about today.
maybe I can take this opportunity to thank Sheena's Place and NEDIC for organizing this. One of the questions is about what do we need to do as a field to help encourage, and I think this type of event, of course, it's probably the people who already have an interest in the field who may be more likely to notice, but in thinking about this spirit and how can we open up these discussions and talk about some of those rewards and how to address some of the challenges that may come up to keep this, in my perception, really forward-moving momentum that we're seeing in the field right now. And thanks to all of the attendees for your questions and your willingness to attend today and engage in the breakout rooms.
Thanks, Jennifer. And John, I think I saw you in mute.
Yeah, just extension of Jennifer's message. A lot of gratitude to you specifically, Caitlin and Ari, for the work you've done. A lot of appreciation for folks who chose to be here. For folks in the Eastern time zone, this is probably beyond your normal workday, so for taking the time and showing the interest. And to the panelists, it's a real pleasure to meet all of you, and hope our paths cross in the future. So thanks to everybody all around.
Thanks, everyone. Yeah, I would echo all the same sentiments. It's been such a lovely time. Thank you, everyone, for attending. Thanks for the really enriching, beautiful questions that came up in the breakout room. And I also know I didn't get to all of them. So if anybody does want to connect after, I'm happy to have like Ari and Caitlin share my contact information, and you're more than welcome to reach out. Yeah, it's just really inspiring to see such a large turnout for this. And I really encourage all of you, despite your fears and your doubts, to do this work if that's what you want to do, and to dive in. It's such a lovely, small but mighty group of folks that are doing great work. So welcome to this field, and please join us.
I echo that and all of what you all have shared. Thank you so much for participating in this panel. Thank you to our attendees for coming and for asking really good questions. I see in the chat as well a couple of ideas. Thanks, Wendy. A segment on TV and reporters. Yes, media coverage is a great way to spread awareness and understanding. Ari has also put a link in the chat. Actually, 2 links in the chat. The first is an anonymous feedback form about today's panel. We are obsessed with feedback. We love it. Please, please, please share what you liked about the event, what you didn't like, and that will help us plan future events like this one. And then the second link Ari has shared in the chat is about facilitating webinars for us. So we are always looking for new ideas and for folks to facilitate webinars. Sheena's Place and NEDIC, as you can see, we do a lot of this together. So we do have an application form, a proposal form, also on SurveyMonkey. So you're welcome to check that out and to share it with whoever you would like. Everyone will also get an email right about now with the feedback form link as well. And again, this will be posted on our YouTube channel in the next couple of weeks. So feel free to share it. And thank you all so much for being here, and wishing everyone a lovely evening.